Good morning. This is All India Radio Kohima. The morning news read by Jonas Yantan. Prime Minister Narendra Modi yesterday reviewed the situation relating to heat wave management and monsoon preparedness. During the meeting, Indian Meteorological Department and National Disaster Management Authority briefed about the persistence of high temperatures in March to May across the country. States and union territories have been advised to prepare heat action plans as a standard response at the state, district and city levels. Prime Minister emphasized on the need to take all measures to avoid deaths due to heat wave or fire incident and added that the response time towards any such incident should be minimal. He stressed that in view of the rising temperatures, regular hospital fire safety audits need to be done. Modi said there is a need to substantially reduce the vulnerability of forests across the diverse forest ecosystems in the country. He directed that in view of the upcoming monsoons, arrangements for monitoring the quality of drinking water needs to be ensured to avoid contamination and resultant spread of waterborne diseases. It was discussed in the meeting about the need for effective coordination between central and state agencies to ensure preparedness of all systems for any incidents in the wake of heat wave and upcoming monsoons. Minister for Health and Family Welfare S. Pangyapam said the state has been leading in the front in terms of community participation and ownership of the public institutions ever since the inception of Nagaland Communitization of Public Institutions and Services Act 2002. The State Health Minister was participating in the 3-day of the 14th Conference of Central Council of Health and Family Welfare under the banner Swasthya Chintan Shivir at Tent City, Govt in Gujarat, which began yesterday. Pangyu maintained that the act has helped the community come forward and take ownership of the public health institution, particularly during the process of upgrading health facilities to health and wellness centers. He said as a step towards universal health coverage, the state government will extend health insurance cover using the Ayushman Bharat PM-JAY framework to the government servants, replacing the medical reimbursement scheme, and to the remaining households in the population. The minister said this extended insurance scheme is being designed and planned for rollout during the year. He also said that the state is steadfastly putting in all efforts and progressing towards making medical college functional, but will need continued hand-holding from central government on account of limited capacities. The minister also urged upon the Union Minister of Health and Family Welfare to extend support towards promotion of healthcare services for elderly and non-communicable diseases. To commemorate the celebration of 75th year of India's independence Azadi Ka Amrit Mahotsav, we present India at 75 quiz with AIR News Kohima, a special quiz on India's freedom movement in its glorious history. The quiz is being conducted every Thursday in the evening news at 7:10 and 7:20 p.m. and continues till 15 August 2022. Recalling our yesterday's question, a brave commander assisted Queen Viramangai Velu Nachiyar, the first female ruler to resist the British colonial power. This commander led the Queen's army and sacrificed her life to save the Queen and her land. Who was this valiant commander? The correct answer is Kuili. And the winner of the quiz is Pushpalata Mohanty from Cuttack. Congratulations, Pushpala, from Team AIR News Kohima. India has strongly objected to the methodology adopted by World Health Organization to project excess mortality estimates of COVID death based on mathematical models. The Union Health Ministry in a statement said that despite India's objection to the process, methodology and outcome of this modeling exercise, WHO has released the excess mortality estimates without adequately addressing India's concerns. India had also informed WHO that in view of the availability of authentic data published through Civil Registration System (CRS) by Registrar General of India (RGI), mathematical models should not be used for projecting excess mortality numbers for India. The CRS data of 2020 published by RGI on the 3rd of May clearly reveals that a narrative sought to be created by WHO based on various modeling estimates of India's COVID-19 deaths being many times the reported figure is totally removed from reality. That is all we have in this morning news bulletin. Have a good day.